Hello. Thank you for taking time to listen to this presentation today. My name is Jessie Wheatley. I am a nurse and an educator. This presentation highlights issues in global health security around the world. Please note that this presentation is applicable and beneficial to all healthcare workers, regardless of their employment, volunteer capacity in global healthcare settings. My views concerning global health security stem from a perspective of a nurse due to my years of experience as a professional registered nurse, a nurse educator in my area of clinical expertise and practice in public health and global health arenas. I present this perspective today because I believe that nurses and other healthcare workers can play a significant role in securing global health outcomes. Nurses, along with other healthcare workers, serve as the front line and most abundant skill set for populations around the world. Nurses have a significant role to play in this regard, especially in resource poor nations where the health security and infrastructures remain fragile and may lack complexity. The issue of global health security is important to all healthcare workers, and this presentation comes at an optimal time to analyze global health security so that healthcare workers such as you and myself can keep an eye on how this impacts the health of our patients. Please stay tuned. What is global health security? According to the Stimson Center, a nonprofit and nonpartisan think tank working on matter of fact solutions to global health security, global health security can be defined as the achievement of widespread access to essential health services and the protection of global citizens from environmental and behavior risk factors of public health and the attainment of systems and agreements that prevent the cross-border spread of communicable diseases and other threats to public health. I encourage you to use a notepad and write down the following key points from this presentation. In the next few slides, we will discuss the significance of global health security factors and how they interplay to impact global health. Next, we will discuss contributing factors to global health security. These factors include politics, economics, and sociological factors. Our next task will be to answer the question, who are the key stakeholders to attaining global health security outcomes? Is it just nurses and healthcare workers like you and me? Is it the responsibility of global health citizens as well? We will explore this. We will also discuss positive changes that could occur from all of us working together to achieve outcomes and what impact our actions would have on this issue. We will then identify key agencies that you as a nurse or a healthcare worker can join to contribute to positive outcomes in global health security. Positive changes can come from us working with many resources. Let us move ahead. Why is global health security significant? What does the issue of global health security have to do with your chosen career of securing health and well-being of your patients? We must first start with the realization that global health security has increasingly become fundamental in global foreign policy. As global health experts, we know that today's health hazards and risks cannot be contained within national borders. Globalization, in terms of tourism, trade, exports, and international relations, have warranted a need to provide instruments and frameworks, guidance, and agreements in how nations govern global health while collaborating to achieve aggregate and population health outcomes. According to the World Health Organization, global health security is an important component of health around the world on both the national and global platforms. It is then crucial that not only diplomats but all healthcare workers, including nurses, share a common understanding of the significance of these agreements and collaborations happening around the world, as they later influence and affect our working environments and our populations. For example, today's foreign policy on security plays a role in the global threat of infections, disease outbreaks, and antimicrobial resistance. All stakeholders must perceive this significance and be well informed. As previously stated, We will now talk about the different contributing factors to global health security frameworks and instruments. There are more factors, but we will discuss the three key factors, namely political influences, sociological perspectives, and economic factors. When we discuss global health security and world politics, we note an apparent trend whereby global health as a whole presents as a key player in foreign policy, as previously discussed. This has been this way for the past several decades, notably across the past 2 decades. However, it is now important for us to make sure that the sustainability of this phenomena not only continues to be an imperative issue in foreign policy negotiations, but also that our present global health goals continue to be adequately addressed rather than just being discussed and debated among our current foreign policies. Have you thought about your role in this regard? Are we discussing or making decisions? As healthcare workers, it is important for us to have a working knowledge of the operational relationship between the health status of our patients around the world, local politics, and foreign policy. Have you stopped to think about how foreign policy issues such as national security, national economic power, and developmental goals affect your ability to improve health outcomes for your patient populations? I challenge you to do so, whether through playing a collaborative role in policy development or through staying abreast of world politics and foreign policy research topics that affect you in your work. Currently, there's a reported decline in the number of global health foreign policy objectives when one observes our current structural, political, economical, and epidemiological decisions from a global platform. What does this decline mean for our work? Can we extrapolate specific ways this affects our working environments and our patient populations? I believe that we can. Politics are definitely a contributor to global health security. We have looked at politics and global health security. Now, let us look at sociological climate of our environment. When one considers global health security from a sociological perspective, it is important to note that there is an interplay between the individual versus the social relationships and the ways in which people and relationships are embedded within specific global communities. For example, I urge you to critically think of the differences among neighborhoods, schools, shops, health centers, and places of employment around the world. How do these affect the health environments for our patients? You can also think in terms of specific sociological issues such as violence and gender roles, for example. How do such issues affect global health security? The publication of the World Report on Violence and Health by the World Health Organization in 2002 identified healthcare workers as crucial key players as the first point of contact for statutory services for victims of violence. The World Health Organization report further calls for partnership in between us as healthcare workers, the criminal justice system, and other departmental agencies concerned with human rights, international, and familiar relations in combating violence in order to improve global health security outcomes. Our contention is that sociological factors, whether they be theoretical or empirical, can contribute critically to this topic and can engage us in conversations that advance global health security. Now, let us examine economic factors. Currently, the global economic system can be described as dysfunctional at best. Presently, structural economic policies are primarily geared towards the pursuit of profit margins at the expense of global human flourishing and the achievement of health outcomes. Global economic factors to note include the growing debt repayment among nations, cuts in health care and budget, especially in the United States, discrimination against African trade, increasing malnutrition, and the economic practices that significantly affect the high rates of infectious diseases around the world. Another area of economic concern noted by Benatar, Gill, and Baker in 2011 regards the laws that enable pharmaceutical industry giants to skew research towards costly medications that yield high profits and away from research on diseases that are afflicting the poor of the world. For example, from 1975 to 2004, of the 90% of medical research expenditure on global health problems, only 10% was for global burden of disease, and 50% was for medical research funded by the pharmaceutical industry giants. In this same time span, of the 1,556 approved drug patents, only 18 were geared towards drugs for tropical diseases. 3 patents were geared towards drugs for tuberculosis, despite the pronounced global need for new drugs for these global diseases. Structural economic policies do in turn negatively affect government expenditure on healthcare, education, and other social services among nations and encourage the privatization of these services. Privatization of global health services negatively impacts healthcare access around the world. Economics are a major contributor to global health security. Now that we have discussed political influences, sociological perspectives, and economic factors, it leaves us to wonder who is responsible for doing something about all this. I believe we are all stakeholders in achieving global health security. We can all work together to achieve global health outcomes. What can be done? Strategies to reconcile current issues with global health security include number one, increasing collaboration with the ethical disciplines to promote civil morality and equality in the moral worth of global citizens. Number two, enhancing collaboration with human rights disciplines to ensure healthcare and medication research is equitable. Number three, focusing on economic recovery to promote macroeconomic stabilization around the world. Number four, mindset changes need to occur in order to accommodate realities of a globalized world and the current disease threats. Examples of positive changes that can occur from implementing the strategies and action plans on the previous slide include significant improvement in health for global citizens, improved global access to effective healthcare services, resulting in optimal protection of global citizens. Health and social development among global dwellers would be attained. Achievement of widespread access to essential health services, enhanced collaborative responses to global disease threats through the attainment of systems and agreements, achievement of widespread access to essential health services. We would be coming full circle. There are plenty of key agencies that you as a nurse or a healthcare worker can join to contribute to positive health outcomes and global health security. Global agencies include the World Health Organizations, the United Nations, and others that are not mentioned in this presentation. National health agencies include the Centers for Disease Control, the Federal Drug Administration, and others that are not mentioned in this presentation. There are also other state health agencies, city and county health agencies, and a lot of nonprofit organizations functioning around the world that would help you be a part of global health security concerns. We have now reached the end of our presentation. I thank you for taking time to listen to my discussion regarding the significance of global security factors in international relations and how they interplay to impact global health security. As mentioned earlier, this relationship is of significance to our work as healthcare workers. We also discuss contributing factors to global health security in terms of politics, sociological perspectives, and financial factors around the world. Of course, there are many other contributing factors that come into play. Feel free to email me at the address on the screen if you have questions or would like to add to this analysis. Remember, we as global dwellers are key stakeholders to global health security concerns. Indeed, positive changes can come from all of us working with many resources. Let us continue the conversation. Email me at nursingland@outlook.com. Nursingland@outlook.com. Thank you.